Hey, this is Dr. Ted Pena, and today we're going to talk about spinal decompressions and specifically the 5 most important questions you should be asking yourself if you're considering spinal decompression. So, question number 1, who needs spinal decompression? Well, it's all in the name. Spinal decompression is meant for people who have compressed discs that need to be decompressed. Many people with compressed discs have a variety of symptoms, ranging from back pain as well as referred pain down into the buttocks, down into the thigh, down the feet, either side, both sides. The list is pretty long. So question number 1 answered. Who needs spinal decompression? People with disc problems. Question number 2, what is spinal decompression? Well, there's actually 2 ways that you can decompress your spine. One is the surgical way and the other is non-surgical. So if you're not in an immediate life-threatening situation and you haven't tried any therapies that are non-surgical, well, you should go that route. However, there are times that, surgery is the best way to go. However, if you haven't had surgery, you should really consider doing non-surgical decompression first. It's safer, the benefits are long, the risks are low, and the likelihood that you would benefit is way up there. I mean, I've seen reports anywhere 86% up to 90% of success rate, and I'm talking about long-term relief. So question number 2, what is spinal decompression? Well, decompressing the discs, taking pressure off of the nerves. Question number 3, and I get this a lot in the office, is table inversion the same as spinal decompression? And no, it's not. They're completely different things. For example, spinal decompression is specific to the area where the spine is compressed. Table inversion, you're getting strapped by the ankles, and then everything else on top is pulling down to gravity. So it's not specific to the spine. Now, I will say this, some people do get relief by stretching their muscles. And with a stable spine, sure, I think it would be a great part of a workout. But for an unstable spine, it's not specific, not a big fan of inversion therapy. Plus, you got to be careful with inversion therapy. When you have things like high blood pressure, circulation problems, you just shouldn't do it. As opposed to spinal decompression, you're lying on your back, you're in an actually recumbent position, you're very comfortable. Sometimes we can have you lying face down. Quite frankly, you're comfortable. That's the main thing. Inversion, if you've never been inverted before, it's not the most comfortable thing. But anyhow, is it the same as spinal decompression? No, it's completely different from everywhere that it's not specific, you're not isolating the pull right where you need it. You're putting pressure on your ankles, on your knees, on your hips, and your back, and your neck, and the circulation. It's something that you may want to think twice about. Okay, question number 4. Can anyone do spinal decompression? The answer is most everyone. No, not everyone is a candidate. Specifically, if you had previous fusion, surgical fusion on your spine, no, you're not a candidate. Sadly, there are patients that don't heal properly from spinal surgery. And if they put plates and screws and hardware, then no, you can't and should not do spinal decompression. However, there are other patients who have had failed back surgery, but they didn't fuse anything, they didn't put any hardware. Well, those patients might be a candidate, but you definitely want to be screened by a specialist to determine if spinal decompression is for you, because you can't just walk into a clinic and say, hey, stretch out my back. Doesn't work like that. Okay, question number 5, where can I get spinal decompression? Well, chiropractors do it, physical therapists do it, some orthopedic surgeons do it. And you definitely want to go someplace that's their specialty, or they do a million of them and they got a lot of experience and they stay up to date on all the research. That's one of the things that we do at our clinic. We've been doing it for many years now. We've seen all kinds of great success. So if you're thinking about where to get spinal decompression, start asking around. You can certainly call our office. We'll be more than happy, if you don't live near us, to find you a doctor who does spinal decompression like we do. Anyhow, that's spinal decompression in a nutshell. We invite you to subscribe. I'm going to keep on giving you content and give you information and do my best to cover topics. If you have any questions, please leave them in the comment section. I'll be glad to answer those. And definitely, I want you to like the video. Hopefully you like it first. Anyhow, Dr. Penny here, and checking out. Have an awesome day.